This is the continuation and the remainder of our reproductive system lecture. We're going to start this recorded lecture with the ovarian and the uterine cycle. So every month, there are hormones that are released by the pituitary gland in the brain. That would be your follicle stimulating hormone and the luteinizing hormone. So imagine that this is the days right here reflect the days of the month. So from day 1 all the way to day 28 is one monthly cycle. So there are a couple of things happening in the cycle. The first one would be what's happening in the ovaries. So the images you see in this part of the slide are what's happening in the ovarian follicles. So as you can see from days 1 all the way to day 27, you have here first a follicle that is developing, and within it is an egg right there inside. So um, with the developing egg, you could see that by day 14, which we can call as mid-cycle, the mature egg is now erupted or released from the follicle. That is an event called the ovulation. Okay. What happens to the follicle after ovulation is it'll basically just become this yellow body known as the corpus luteum, and that will secrete some hormones. Okay. And eventually it's going to shrink and just become this yellow body, which is just connective tissue. It's no longer an egg, it's no longer a follicle. Think of it as scar tissue. Okay. So aside from ovary, there's also, aside from the egg in the ovary, remember that the ovary itself is an endocrine gland. So it also releases its own set of hormones, and that would be estrogen and progesterone. By the way, let's go back here. The luteinizing hormone has a surge or a sudden increase on the day of ovulation, and this is actually the hormone that causes the follicle to rupture. Okay? So let's go back. Now, in the uterus, there's also some changes that's happening because of a rise in estrogen and progesterone. So here is the endometrial lining of the uterus. No? In the first few days of the monthly cycle, we call that the menstruation stages or days. You could see a very thick endometrium, and from days 1 all the way to say day 5, you know, there's menses, there's blood, there is endometrial tissue coming out of the uterus, out of the vagina, and that is the date of menstruation. Now, after day 5, you could see estrogen going up. Estrogen is an anabolic hormone. It builds tissue. So you could see that the uterus is building up again. It's getting thicker again. A lot of blood vessel. It's nutrient rich. By the time of ovulation, when an egg is released in the ovary, your endometrium, the endometrium is already thick and nutrient rich, which means it's ready for implantation just in case the egg right here gets fertilized. Okay. Say there is no fertilization, there's no sperm that came in and fertilized an egg. What happens is eventually the progesterone levels that initially went up is going to decrease or wane down. As progesterone level goes down, the sudden withdrawal from progesterone will cause that very thick endometrium to get sloughed off or get shed off again. And right here will be the beginning of the next menstrual cycle, which will be another day 1. Okay. Note that this is showing you a 28 or 30-day cycle, but not every female has that number of days for a cycle. I know someone who have only menses twice a year or ovulates twice a year. Some will have longer cycles, others will have shorter cycles. Okay, so again, this is the typical physiology textbook explanation. Okay, so from that slide, you saw estrogen as one of the hormones from the ovaries. Functions of estrogen is it produces or it forms eggs or ova. Okay, it grows the follicle in the ovary. It has anabolic effects. Again, anabolism is building tissue. It also plays a role in the growth spurt, which happens at puberty. Aside from growth spurt, we do have other secondary characteristics that show up during puberty. You know, examples of that secondary sex characteristic would be development of the breast, fatty deposition, fat deposition in the hips, in the buttocks, voice changes, pubic hair, axillary hair. uh, Those are all because of estrogen. Okay? There are metabolic effects of estrogen which we like, and that will be it lowers cholesterol, it increases HDL, which is the good cholesterol, and then it also facilitates calcium uptake. All the benefits of estrogen. The other hormone you saw there is progesterone. This works well with estrogen to establish a regulated cycle. It promotes changes in the cervical mucus. It thins out the mucus, allowing the sperms to swim through, but it also thickens the mucus. Well, depending on the time of the month, the mucus can actually change in consistency. In addition to that, progesterone coming from the placenta will inhibit uterine motility. What that means is it does not allow the contraction of the uterus during pregnancy. We don't want the uterus contracting during pregnancy. That could lead to a miscarriage. Progesterone also prepares the breast for lactation. Lactation is milk production. Okay. Menopause is the cessation of menstrual cycle, cessation of ovulation. Basically, we ran out of eggs, we ran out of estrogen. All the eggs have been ovulated. What's remaining are those white connective tissue in the ovaries. Now, the effects of menopause is, of course, a decline in estrogen levels. Being an anabolic hormone, if we don't have enough estrogen, there will be atrophy or shrinking of reproductive organs, which includes the breast. Other signs and symptoms of menopause include irritability, depression in some, hot flashes, thinning of the skin and the bones, resulting to osteoporosis, an increase in cholesterol levels. Um, some females will have very prominent menopause signs and symptoms that may require hormonal treatment. Okay. So the breasts are also part of the female reproductive system. So let's talk a little bit about breast cancer. There are many risk factors for breast cancer. The thing that we know about is family history right here. Okay. So let's talk about the first three bullets. Okay. Having an early onset of menses, say age 8 or 9, that's pretty early. And having late menopause, let's say age 55, we're exaggerating that a little bit. So that means you have a long reproductive years. From age 9 to age 55, we know that every month there's high levels of estrogen. So that would be many years, many months of being exposed to our own estrogen. That's a risk factor for breast cancer. Now, the second here is no pregnancies. Remember that a pregnancy is about 9 months. So 9 months of saving ourselves from too much exposure from estrogen. So imagine having 10 pregnancies. 10 pregnancies times 9 months for every pregnancy. That's again less exposure to estrogen. Same thing here, breastfeeding. So if someone is breastfeeding, they're actually less at risk for breast cancer because breastfeeding suppresses estrogen. So the longer you breastfeed, the less exposure to estrogen. Now, there are women actually who don't even have any of the known risk factors and still develop breast cancer. Okay, so it could be cumulative effects. It could be of aging, pollution, chemical exposure, but there's no specific. Sometimes they just show up in women. And then there's also the genes BRCA1 and BRCA2. So about 10% have that risk factor, and those who do the 10% will, of that 10%, about 50 to 80% will develop breast cancer. I'm not sure if you know or you've heard about the Jolie effect pertaining to Angelina Jolie, but Angelina had her breast removed. She had a bilateral mastectomy, okay, because she was positive for the BRCA gene. She didn't have any risk factors of any other risk factors of breast cancer. She didn't have signs and symptoms. The risk is, uh, 50%, but she decided to have breasts removed. Also, her mother died of breast cancer. Now, the Angelina effect is, how sometimes celebrities influence other people, including with their health decisions. A lot of women actually had elective bilateral mastectomy following Angelina's decision to have hers. Um, what many people do not know is that Angelina actually had her ovaries removed as well, because you don't if the hormone comes out of the ovaries, the hormones that influence the breast. Okay, so the procedure is much more effective if breast and ovaries are actually removed. But again, the oophorectomy or removal of the ovaries were not sensationalized. The breast was the one that was sensationalized. And again, many of the women who followed this trend, if I may call it, only had the mastectomy. Okay? So this is a procedure known as a mammogram. So it's an X-ray where there is an early detection of breast cancer, because lesions, very, very small lesions that are not palpable um, by the patient or by the physician, can actually show up in a mammogram. Breast cancer is the leading cause of cancer in women or in females. Okay, males can also develop it because males have breasts as well. But since the advent of mammogram, there's early diagnosis and better outcome for breast cancer. So now we go to fertilization and pregnancy. So when the sperm and the egg unite, what you have is a zygote. Okay. Now, where does fertilization take place? Where in the reproductive system? Is it in the ovary, the vagina, the uterus, or the fallopian tube? Okay. So think about that. Where in the reproductive system does the egg meet the sperm? Okay. Now, that zygote will divide, mitosis will take place right here. It will move to the uterus, and that is where it will implant in the blastocyst stage. So the zygote will divide from one cell to two to four cell until you have this type of embryo, which will implant on the uterus. Okay. Now, this is an image showing you that the embryo actually implanted in the fallopian tube. It did not travel down to the uterus, but it implanted there. Okay? That is called an ectopic pregnancy. Ectopic means anywhere but the normal site. So to be specific, that picture I showed you is actually tubal pregnancy. It's in the tubes. Okay? Now, no ectopic pregnancy does reach term. So those will result into a miscarriage or a therapeutic abortion, because if it's allowed to stay there, it will just really cause a rupture of the fallopian tube, and it can cause hemorrhaging and death, of course. Um, and those who survive an ectopic pregnancy, um, with the body healing, those who survive ectopic pregnancy, it may result to a PID or a pelvic inflammatory disease, which is infection all over the abdominal or peritoneal cavity. But those who recover from it, it healing of the body can result to scar tissue that can result to infertility. Okay. I don't know what happened to this slide, but this slide says methods of birth control. Birth control is often called contraception and also family planning. Okay, so there are birth control methods that are also against the transmission of sexually transmitted infections up to a certain degree. And that is important to consider when choosing a contraceptive. Okay. If you're not in a monogamous relationship, it is important to protect yourself from STI. Okay. So here is an image showing you different types of family planning methods. We have male and female contraceptive methods. We have permanent, semi-permanent. We have temporary, using it at the actual time of intercourse. Some will last for years, some will last for months, and some will last for days. Okay, I'm going to share with you a video about this different types of family planning methods. It's actually another project submitted to me years back. Okay, so being aware of fertility, how do we know that we are fertile or we are ovulating? When I say fertile, that means the time of ovulation. A few things, natural methods, cervical mucus. Okay, the consistency of the mucus coming out from the cervix and the vagina changes during the days of the month. If it's very liquid, it's wet, then that's a sign of ovulation. No intercourse if you don't want to get pregnant. No, when it's wet and liquefied, that means sperms can easily swim through. And when it's thick and viscous, that means sperms could not go through. Another way of determining ovulation is body temperature method. So females' basal body temperature rises, after ovulation. Okay, so basically, um, the woman or the female will take their temperature at the same time of the day every day, and when you see that sudden rise in temperature, that is a sign that ovulation is taking place. Okay, so whether it's planning a pregnancy or avoiding a pregnancy, this is another natural method to use. Okay, and then we have the calendar method. Okay, again, this is a contraceptive method, natural but not um, always successful, or it's also a way to plan. So here's a calendar showing you days 1, days 2, 3, all the way to day 28. So that is reflecting the days of the month in the menstrual cycle. Now we said that mid-cycle, in a 28-day cycle, that's day 14, ovulation takes place, and that is the egg is being released, which means this is the day that there should be no intercourse, right? The calendar method, if you track your ovulation. Now, it is not the calendar method though. The calendar method is not just one day of no intercourse. The calendar method is a little bit more than a week, 5 days before ovulation and another 2 days after ovulation. There should be no intercourse if you're not planning a pregnancy. Now, ovulation is only about 12 to 24 hours. It will only last for 12 to 24 hours. So why is it that a couple should not have sex before and after if the eggs are only out there for 12 to 24 hours? That's because the sperms can actually survive for up to 5 days. Okay, so sperms can be deposited on day 10. Even if the egg is not there, they can wait patiently until the egg is released from the follicle. So that's why the calendar method is about a week of no intercourse. Okay. By the way, if a female does not have an exact 28-day cycle, let's say it's a shorter cycle of 20 days, it doesn't mean that ovulation is day 10. It's not in the middle of that cycle. Same thing, if the cycle is longer, like 40 days, it doesn't mean that the egg is released on day 20. No? That's not accurate. No? The proper way to do it is always deduct or subtract 14 days from the last day of every cycle. Okay, so if you are 40-day cycle, then 40 minus 14 days is the date of ovulation. If you have a 20-day cycle, which is short and unfortunate, then it's 20 minus 14. That means day 6, you're already ovulating at day 6. Okay. Okay, so this is just showing you what happens when you have identical twins. If it's fraternal twins, that means two eggs and two sperms. Okay, separate pregnancies in one womb. But identical twins, they come from one egg, one sperm, one zygote that will split eventually. Now, if the splitting happens early, okay, before the implantation, you will have two amniotic sacs, two bag of waters, and two placenta separate. Okay, so the zygote separated early. Mm. That means although they are identical twins, the features are less identical compared to identical twins where the implantation happened first before the splitting of the embryo. So when they implant on the uterus and then split later, that's when the twins are going to share one amnion, which is your bag of waters, and one placenta. Okay. And I think everybody knows our identical twins right here. Okay. So now we're looking at pregnancy. So we have the successful fertilization and implantation. And this image, just go over it, you could see the different changes that could happen in pregnancy. Let's pick a few examples. There's morning sickness. We know that there's absence of menstruation. How about this? Let's look at this. The diaphragm goes up because of that expanding baby, growing baby. So if the diaphragm is pushed up, there will be a limited um, thoracic volume. It will a lot of pregnancy in the late stage will have difficulty of breathing or shortness of breath, not because of a disease, but because of the decreased volume up here. Okay. Another one would be, oh, look at the baby growing in the uterus. The urinary bladder down here is being compressed. So that means the capacity of the urinary bladder is also less. That's why pregnant women, they always go pee because of the limited capacity. Okay. So read through this. There are skin changes, there are ligament changes, there are obviously enlargement of the breast, enlargement of the abdomen. Those are all different signs and symptoms of pregnancy. So we take care of our pregnant individuals. We want to make sure that they have the right nutrition and the right amount of exercise as well. Okay. They take supplements, specifically folic acid, to facilitate the development of the nervous system, iron, calcium, and additional calories. Um, in OBGYN, we have what we call as geriatric mother. Geriatric is a term we use for, someone who's older, but in pregnancy, we consider someone over 40, as geriatric. Okay, that's quite common now to have babies at the later age compared to many decades ago. Okay, but studies show that there's a higher incidence or prevalence of Down syndrome um, with older mothers. Okay. In addition to age, there are other factors that can affect the development of the embryo, x-rays, toxic chemicals, metals, pesticide gases. So we have to be careful, what we expose our pregnant individuals to, what they take in. Here's an example in history back in the not sure if it's 50s, 60s, or even 70s. There was this very popular drug known as thalidomide. It was given to mothers because of morning sickness. So they used to treat morning sickness before with thalidomide. Unfortunately, it resulted to abnormalities like this, babies born with missing limbs. Okay, so they found out it was thalidomide, so it was taken off the market. Okay, So aside from Down syndrome, no, another age-related risk is miscarriage. Okay, so now it's time to go to the hospital. How do you know that there is impending labor and delivery? How do you know that it's that time to call Uber or get in the car and drive to the hospital? Well, many of you would probably say the rupture of the bag of waters. That's correct. Contractions, you know, the frequent and increasing intensity and regular interval type of contraction, not the false labor pains. Third would be bleeding, vaginal bleeding. You don't say, "Oh, finally, my menses came back." No. Bleeding at the ninth month of pregnancy is a sign that you're about to go into labor. And then the last one, of course, is the one shown here, the cervix dilating. Okay. So the cervix dilating, opening up, which is the beginning of delivery. So you could see the baby's head being engaged. Of course, this is if the head comes out first. We're not talking about breech, but pretty much the stages are the same. Finally, we have the expulsion of the baby as it's being delivered. And minutes later, in an hour, the placenta is also delivered. So we all had a twin, the placenta. Baby delivered 8:05, placenta delivered 8:14. That's why it's also called the afterbirth. The placenta comes after birth. Okay. Now this image in history shows you a cesarean section, so not a normal vaginal delivery as the previous image showed, but they called it cesarean section because initially that Julius Caesar was born by cesarean section. They named it after him. They said that the mother, the empress back then, was in crisis, so they decided to butcher Game of Thrones style to just to deliver Julius Caesar. But you know, other historians illustrate that Julius Caesar was actually not born by cesarean section, but the operation obtained its name because the Roman law was required of the procedure, was required when the mother is dying or passed away during birth, and they allowed the abdominal incision to remove the baby from the mother. Just a little bit, of trivia right there. Okay. So infertility. Infertility is defined as the uh, inability, to reproduce, inability to have a pregnancy after 1 year of unprotected sex. But again, it's a current but also an old definition because nowadays we don't really wait for a year to establish infertility. We have a lot of tests to know early enough if a couple is infertile or not. Okay, there are many causes of infertility. The most common cause in females would be hormone problems, like those coming from polycystic ovarian syndrome, and then for males, it's low sperm count. Okay. There are many drawbacks of infertility treatments. Okay, for example, multiple fetal births that result in difficult pregnancies, organ damage, bleeding. Fertility drugs have a lot of side effects and could be life-threatening. And then there's ethical considerations like what to do with other embryos when you don't need them anymore. Okay, so I have a picture here of many of you know her, perhaps, Sofia Vergara. I just remember reading an article about her many years ago. Um, so she had her boyfriend uh, years ago, I think a decade, and they created embryos that they preserved because they're planning to have a pregnancy much later. Unfortunately, they split up. And when they split up and Sofia Vergara got married to another person, the ex-boyfriend wanted to have the embryos, and put it in a surrogate. Sofia Vergara did not want that, no. She In fact, there was a big lawsuit that was transferred from one state to another until finally Sofia Vergara won the lawsuit and the embryos were destroyed or donated. I'm not sure, but again, that would be like the ethics of IVF. Okay, so I have here a few pictures of assisted infertility technologies, or if a normal process could not complete a pregnancy, we have what we call as artificial insemination by a donor, which is the first picture you see here. You could see the sperms are being artificially introduced into the female. Okay. Then we have in vitro fertilization. Uh, this picture right here, the one with the petri dish over here. So an egg and a sperm meets on a petri dish. Fertilization happens, and then the embryo is implanted, you know, into the fallopian tube. The image up here, this image right here, shows you that an egg and a sperm is introduced into the fallopian tube in the hope that they're going to meet naturally. Okay, it's the closest thing to natural next to insemination. So your gametes are your eggs and sperm introduced into the fallopian tube. That's it. And then we have the last picture here is your intracytoplasmic sperm injection. That would be one lazy sperm. This is the egg, and the needle here has the sperm that will fertilize this egg right here. I call it the lazy sperm because it wouldn't even take that journey, unlike the other methods here. And finally, our last assisted reproductive technology is surrogate mothers. Surrogacy is when a woman is hired or asked to carry the other person's pregnancy. Okay? So that ends our lecture on reproductive system and pregnancy. Good luck, everyone, to your final for your final exam. Thank you.